This week, doctors in children's hospitals across the province sounded the alarm that this was going to be no ordinary flu season. Already, pediatric ICU capacity is at or beyond its limits, and parents aren't far behind. With us now for more in London, Ontario, Dr. Rod Lim, Site Chief of the Pediatric Emergency Department at the Children's Hospital at London Health Sciences Centre and an Associate Professor at Western University. And here in our studio, former director of the COVID-19 Science Advisory Table, Dr. Fahad Razak, who is an internist at St. Michael's Hospital and assistant professor at the University of Toronto. Hi to you both.
Hi, good to be with you.
We really appreciate your time because we know right now it's such a taxing time. Dr. Razak, I want to start with you. We're hearing about a host of viruses affecting children in the province at the moment. Can you clarify what viruses we're talking about?
Yeah, Nam, it is a very difficult time, and what we're seeing right now is a resurgence of some of the viruses that we hadn't really seen very much over the last couple of years. So we're seeing a high rate of influenza, the flu spreading, RSV, and then other respiratory viruses, and along with still some COVID cases in children as well. This has been called a tripodemic because it's these three viruses coming up together. The important thing for our emergency resources for parents is that kids are getting sick and getting access to care is increasingly difficult right now.
We're going to talk about that because even now you can't even go to a pharmacy to get Advil and Tylenol. Dr. Lim, compared with last fall, are we seeing an increase in respiratory illnesses among kids in this province?
Oh, I mean, that's an easy comparator because last year, really, we didn't have any influenza and RSV season at all. Even based on historic numbers from before the pandemic, what we're seeing now is really unprecedented. It's very early. Viruses are circulating in unusual times. We had RSV in the summer, which is, again, I've never experienced in the 22 years that I've been working. And influenza has come early. So I agree that the viruses are here. It's early, and we are anticipating quite a difficult fall, winter.
Can you explain to us why it's happening this year? Why it's happening now?
Yeah, I think most of it is that we've had a sheltered population for about 2.5 years. We had almost no flu activity last year at all. And if parents remember what it's like when children first go to daycare or first go to school and they're sick all the time, we just have a large proportion of children who are ready to become infected. And we've certainly had relaxation of a lot of our public health measures. So children in schools, people at work, lots of ability to transmit the virus. And usually the virus likes colder weather and more indoor congregations. So the fact that we're seeing it already now when the weather is just beginning to cool is quite concerning. The numbers that we're seeing right now are through the roof. This is going to be our busiest November of record. We are built for about 100 visits a day, our capacity, and we have hit over 200 just 2-3 days ago.
Wow. The cold weather is not here yet.
Nope.
And Dr. Lim mentioned that we, over the past few years, we've been in these sheltered environments. Do we know roughly how many of these are due, what's happening right now is due to COVID versus the seasonal flu versus other illnesses?
For kids right now, the majority of illnesses that are happening are not COVID. It's still the traditional viruses that would circulate heavily prior to the pandemic are now making that resurgence. So it's predominantly flu, RSV, and other respiratory viruses. And just to give a sense of how different this season is versus what we had during the pandemic, on a typical year, there was a study across Canada that looked at about 90% of children's hospitals. And you would get about 1,500 admissions for influenza in kids on a typical year. Mm-hmm. From 2020 to 2021, there were 0 admissions, 0 for children during that period. And now you're seeing this enormous surge. So you're getting a wild swing, and you can really see the suppressive effects of what happened during the pandemic.
Can you explain to parents why it's happening now? Because I think a lot of us are kind of like, if kids used to get it before, I understand when we were masking and maybe we were keeping away from each other, but why is it happening now?
Yeah, so you have a cohort of children that were born and are young who really experienced their lives during this pandemic, so with reduced exposure to viruses. And now you're seeing with schools back and forth, with all of these public health measures that have been lifted, especially in schools when you have a lot of kids packed in together, that is the environment where viral spread occurs. So you're getting these viruses just racing through the pediatric population, and you're getting this surge, which is, as Dr. Lim said, is frankly worrying because it's only November. What does this look like over the course of the respiratory virus season in December, January, and February? That's the great worry. We've already outstripped our existing baseline pediatric ICU capacity in the province. We blew past it this past week. Now, look, everyone in the hospital sector, we will rally, we will do our best, but all of you know that when you're past capacity, at that point you're triaging. You're starting to pull in a resource here, pulling a resource there. It becomes increasingly difficult, and you're deferring other essential parts of the healthcare system, like scheduled surgeries, routine follow-ups. All those things get pushed back.
Okay, I'm going to come back to the impact and some of the solutions. Dr. Lim, you mentioned RSV. What is that?
Yes, it's a lot of parents don't think about it after their children are a little bit older. It's respiratory syncytial virus, very common, tends to just cause cold-like symptoms in older people, but it's the very young that we see it that has a tremendous impact. Children under 2 years of age, they can present with a lot of breathing difficulty, sometimes feeding difficulty, sometimes apneic spells, and certainly, we are very used to having an RSV surge in the later months every year at children's hospitals. It always taxes our capacity because it is such an impactful virus. But this year, it's the enormity of the number of young children that we're seeing come in that require respiratory support, that require advanced machines and things like that to support some of the young children coming in is certainly something that I've not seen before.
You must be worried because we are talking about we have limited beds. We have children are being moved from pediatric hospitals to adult ICUs. This must concern you.
Well, I mean, nobody takes care of children that aren't passionate about children. At the end of the day, we need to provide, empathetic, compassionate, excellent care to all children. And right now, it is a real struggle. We are trying to be as creative as we can. We have literally set up so many chairs in our hallways where we're seeing patients who have waited way longer than we're used to, which is extremely taxing for parents, very stressful for the parents. But, this is a team of incredibly skilled and dedicated individuals that are forced to be incredibly creative right now under very trying circumstances and working incredibly short. The human resource issues right now that we're facing are compounding the huge amount of work that has to be done because of the acuity and the number of patients that are coming in. These people that are showing up, they have my, absolute admiration. They're fantastic people trying to do an incredibly difficult job in an incredibly difficult time.
And, I'm a parent, you're a parent, we never want to see our kids struggling. And I want to ask you both this question, and I'll start with you, Dr. Lim, first. If the current surge in hospitalizations continue, will hospitals have to start triaging children?
Triage is a broad term. I mean, to some extent, right now we are moving patients around, community hospitals to tertiary care hospitals, sometimes to adult hospitals, depending on the support that they need. I've just firsthand in terms of the local environment that I've seen, people are bending over backwards to try to support each other and to try to create that safety net that's so important for children. I don't think any of us want to see something that is curable, treatable, come to harm to a child. I don't think any of us can fathom, that kind of reality. The amount of energy that these people are putting together to try to stay coordinated, I just cannot emphasize much. Picture the most busy airport you've ever seen and double it. We are running around trying to do our best and trying to stay human because we know this is so stressful and so hard for parents. So we aren't at that point right now. We're certainly moving a lot of these resources around and trying, but yes, of course, that is what we worry about.
It's really hard to imagine the scenario that you're painting, that this is happening in the province of Ontario.
Yeah, I totally agree. And what Dr. Lim's describing are these heroic efforts to rally in every sector, to pull on some of the pediatric staff from one area, to move some kids over to adult hospitals. But remember, those other sectors have also been stressed repeatedly for the last 3 years, upon wave, upon wave, upon wave. And if you look at the adult hospital sector, which now being asked to start to absorb some of the older children and provide care if needed, the adult sector right now has just gone through a summer wave of cases that they've had to manage, and they are looking towards potentially a fall and winter wave of influenza. I'll use my own hospital as an example. In the winter before the pandemic started, this was pre-COVID, our volumes increased by nearly 50% in a flu season. So if that same sector is now being called on to rally to help with the pediatric hospitals, what happens over the next 8 weeks if an influenza surge dumps a lot of patients into the adult sector? So these are the trade-offs, and it's very difficult to see how the pieces can continue to be rearranged.
It seems as if you're all playing like a game of Tetris, except this is not a game. Dr. Lim, does this mean that you're taking away resources from surgeries and other treatments to handle what's happening right now?
Yeah, I mean, if you look at the publications around what's been happening at Children's Hospital of Eastern Ontario, where they've opened a second pediatric ICU, they have had to make some difficult decisions and cancel some scheduled surgeries. There always has to always come from somewhere, and obviously things that we don't like to see delayed. Sometimes people have to make the difficult decision that that's the best interest in the time that we're facing in that exact day. So there is a lot of movement around, but it comes from somewhere. And someone is always being affected by all the choices that are being made. So, we try to make the best choice for the greatest need at the time. But none of this does not impact down the road, for sure.
We know that in this province, there's a lot of families that don't have family doctors. And now parents, when they go to pharmacies, they can't access Advil or Tylenol. To what extent is this contributing to the pressure on what's already happening with pediatric hospitals in this province?
Yeah, undoubtedly this is contributing to it. So you have approximately 2 million people in Ontario who don't have access to a family doctor. Many of these kids now are getting sick, either in schools or exposures in other places. When they're sick, they don't feel well, their throat is sore, they have high fevers, and now we're having trouble getting access to pain medication. This is something that our family has run into as well. So what do you do as a worried parent at that point? You take your kid to urgent care, and that's part of this influx that you're seeing. So it's a very difficult situation, and the problems with getting access to pain medication, I have to say, this has been 6 months now. Mm-hmm. There should be solutions in place at 6 months. I understand acute shortages, but 6 months of shortages is a very long time for medications that are routinely available across the world.
You hear this sentiment from parents that they're very frustrated, and obviously maybe my view is kind of tainted because I am a parent and I've been in that situation where I'm trying to find Advil and Tylenol, and we're trying to find solutions of what to do. Dr. Razak, there's been some discussion around the Ministry of Health bringing back mask mandates next week to curb the spread of these viruses. Where do you stand on this?
Look, I think mask mandates are a very difficult issue, and they've been highly divisive over the course of the pandemic. But what you've seen is that people in Ontario, Canadians in general, when asked to do this, would willingly follow through with mandates, understanding that it's a targeted strategy, it is a blunt tool, but often it's a tool of last resort when you are seeing the crises we are seeing currently. So there was 2 polls done this week, which are very informative, I think, in thinking about how the public is thinking through this issue. One was by Nanos, the other was by the Public Policy Forum. Both suggest that roughly 7 to 8 out of 10 people are already wearing a mask or would be willing to put on a mask for a mandate in crowded indoor settings if asked to do so. I think it highlights that you have to give people a rationale. You have to say, this is why we're doing it. This is a strategy to help our system. And people, by and large, would be accepting of it.
I'll just push back a little bit. What I've been hearing, the discussions is to have the mask mandates in schools, but kids are part of communities. And would it make sense to have a mandate if people are not buying into it?
Yeah, look, I think that we have asked kids to do a lot over the pandemic. If you look at Ontario and if you look at Canada, we had some of the longest school closures of any comparable wealthy country. Those school closures were often rationalized to protect the adult healthcare system. So we closed schools to protect the adult healthcare system. I do not think that we should be asking this of children without asking something similar of adults. So if you're going to do this, you should at the very least have masking within busy public settings that everyone goes into, within transit, grocery stores, healthcare settings. It would be, I think, unreasonable to just ask for a mask mandate in schools. Now, still there's going to be spread. There's going to be spread, but it would be an attempt to reduce that spread as a starting point to see whether we can start to blunt some of what Dr. Lim and colleagues across the province are seeing. I think it's a starting point, and it will take time to work, and there is a real urgency right now to the crisis.
Dr. Lim, Ontario Minister of Health Sylvia Jones released a statement earlier this week saying pediatric hospitals had the full support of the government. Could the government, in your view, have been more proactive in placing some measures before we got to the place we are at now?
That's an excellent question. And I think even broader than that, if I may, seasonal variation and pressures have been a reality since I've been a physician. So for over 20 years, we know capacity in the wintertime is always a difficult situation. And what I think about when I hear the conversations that we're having is, how can we be proactive? I know we're in a fire right now and we need immediate solutions, but these questions are going to be with us next year, the year after that, and the year after that. And when are we going to talk about investing in healthcare to the point where we have capacity? We are able to not run so close to full at all times for efficiency so that we have options and ability to flex up when things happen and we don't have to push buttons in terms of, when we're in emergency situations. I think, when I look at the state of manpower in the nursing profession specifically, how decimated that profession has been over the last year, and how long it's going to take for us to rebuild that important aspect of our healthcare system, we need to be having those kind of conversations and very thoughtful conversations about the type of system that we need that's healthy and resilient and able to respond to these surges that are anticipatable. Like, we know this is going to happen. We know it's going to happen again. And we can't wait for these things to happen and try to juggle things every day when we know that this is our future. So I think we just have to have these important conversations and planning, because I think the more coordinated we are and the more thoughtful we are with these solutions, the better they're going to be.
And Dr. Razak, I want to ask you that same question. Could the government have done something earlier?
Yeah, my personal feeling on this is that these mandates should have been, or at least a very strong encouragement. You don't have to move right to mandates, but a very strong encouragement with clear leadership from public health around using a mask, the necessity of it, the crisis, wearing that mask publicly in all settings to show people how important it is. That should have already happened. But, there's a proverb: the best time to plant a tree was 20 years ago. The next best time is now. We're now. So what can we do now? I think at the very least, there should be extremely strong public messaging to say it is critical. Wear your mask every crowded indoor settings. Many people, including myself, think that because of the pace of spread now, we're even past that part. We have to go fully into the mandate requirements in transit, grocery stores, essential public settings. People can still go to other places on their own risk. This shouldn't affect restaurants or gyms or other places. I'm talking about places where people have to go as part of day-to-day life. They have to get to work on a bus or on the subway. They have to be in school. They have to go into a workplace. So these are the areas where I'd like to see it in place.
And it also seems as if we are kind of, journalists anyway, are kind of hungry for data because we don't have access to the information we had maybe a year ago. Even for the public itself, we used to have updates on TV, on reports. So when it comes to testing, do we need to test more?
I think it would be helpful. The data on influenza testing right now already is a warning signal. So an influenza season is declared typically when more than 5% of tests are positive. We blew past the 10% mark in the last week. So it's clearly showing there's a rapid surge. It's also occurring very early. And we have data from other parts of the world, like Australia, to suggest it could be quite a severe season. COVID testing is something where I think there would be a lot of value in bringing in more enhanced COVID testing. We've lost the ability to really get a sense of how this virus is spreading across the province right now. Again, it is not the only challenge in the system, but I do think that data to get a sense of COVID, influenza, RSV, when you put that together, you can really paint a much clearer picture of where you need to prioritize and the degree of acceleration. We've lost some of that now.
And, since I have both of you here, we're talking about masking mandates, and I think earlier in the pandemic, people were maybe more agreeable to do it, and you've both been working in an environment where you're trying to keep us safe and healthy while you take care of yourselves as well. And I just wanted to ask you both quickly, Dr. Lim, I'll start with you. What keeps you going in an environment where you're trying to keep people safe, and then there just seems to be this divisiveness and maybe lack of information that people are trying to understand where we are right now.
Yeah, I mean, I'll start to say that, I just want to bring up at the point that I mentioned the nursing force, the physician force we know is getting increasingly unwell and burnt out and under facing extraordinary pressures. And we also have to have a very conscientious conversation around physician support and physician health. I think for me, I've always just tried to look at the big picture. There's things that I cannot control, which is the environment that I'm working in, the degree of sickness that's out there. But what I can control is I can help the people that are in front of me, and I can advocate for systems to respond to the needs of the people that I'm trying to help. If I keep my eye on that, and I keep my eye on the patient that's in front of me, even if I'm seeing them in a chair after they've waited a huge amount of time, I know that I can continue to do, and my team can continue to do a good job to help them, even under extraordinarily difficult circumstances. It is a pleasure to serve in healthcare, even under extraordinarily difficult times. And I'm going to put a big shout out. I cannot thank the people that show up every day right now under extraordinarily difficult circumstances, and they're doing very important and incredible work.
And Dr. Razak, I think one part of this is that parents just don't know what to do. Yeah. What advice would you give parents who have a sick child but can't access medicine and might not have a family doctor?
Yeah, I'll just start by echoing Dr. Lim that it's a privilege to work in the healthcare sector, but it is increasingly a heavy experience and it's exhausting, and I do worry about resilience. To the question about parents, remember that we in the hospital sector, both for pediatrics and for adults, we're dealing at the very downstream end of a sequence of events. So what we need people to do is to do as much as they can upstream to try and reduce infections. It's the things that we have talked about. It's getting your vaccines up to date. There is an influenza vaccine right now where uptake has been relatively low. It looks like it's a very good match for the virus that is circulating this year. Please go out and get your influenza vaccine. It takes a couple of weeks to be fully active. We're in a surge now. If your COVID vaccines are not up to date, now is the time to get your COVID vaccines up to date. And then the public health part of this. So wearing a mask in indoor crowded settings, a good quality mask. If you can wear a respirator, great. At least a surgical mask, if not a respirator. Reducing exposure events. So if you're sick, don't go out into that crowded indoor setting and expose a lot of other people. So it's the things that we've always talked about. It's the strategies that we have left to us that could be important over the next 2 to 3 months, which is what we're really talking about. And then it's the longer term solutions, which the government policymakers, public health, have to sort out, staffing, capacity. But for parents, for all of us individually, do what you can now to protect and reduce the chance that your kid is going to get infected.
Dr. Razak, Dr. Lim, thank you very much for your time. We really do appreciate everything that you're doing for the children in this province and for us as well. Thank you very much.
Great to be on.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.